They are effective at doing what they were intended to do, and we've seen this time and time again in data around the world constantly coming in. So breakthrough infections shouldn't be a surprise to us. They certainly aren't a surprise to those in the medical profession. Hi, it's Dr. Emily Isham here again for Rare Cancers Australia. So today I'm going to talk a bit more about breakthrough infections and why they're happening, why they are not a shock to us in the medical profession, and why we still need to maximise the number of people getting vaccines within our cancer community to reduce the risk of COVID-19 for those who can't get vaccines themselves, and to also reduce the spread. So it is really relevant. So vaccinated people are getting infections. And there are two reasons we're seeing higher percentages of vaccinated people getting infections, which is what we're hearing from overseas as well. Firstly, if there is a highly contagious disease spreading as more people get vaccinated, the bigger proportion of the community is vaccinated. Thereby, it will look like more vaccinated people are getting the disease. It's kind of like looking at basketball teams getting a disease and saying, well, all the people getting sick are tall, therefore being tall must mean you're more likely to get it. And secondly, no vaccine developer or doctor has ever said these vaccines are 100% effective, or any vaccine for that matter. There are no conspiracies or lies, and doctors get informed consent from each person before any single medication or procedure or vaccination they give to that person. So as I've said previously, these vaccines are very effective at reducing transmission, both above 90% at reducing hospitalisation and death from the Delta variant after having both doses. One dose is okay, but it's really best to have both. It is still possible to get COVID-19 once you're vaccinated, and figures from New South Wales at the moment are showing that the vast majority of people hospitalised in ICU and ventilated are unvaccinated. Some have had only one dose. But no vaccine is 100%. They are effective at doing what they were intended to do, and we've seen this time and time again in data around the world constantly coming in. So breakthrough infections shouldn't be a surprise to us. They certainly aren't a surprise to those in the medical profession. Do let us know if you have any further questions about how this might be relevant to you within our cancer community. If you are concerned, you're worried about eligibility, you want more information, some great websites that you can access are health.gov.au, the website provided by Melbourne Vaccination Education Centre, so MVEC, the Australian Academy of Science, and NCIRS. They all contain so much information and education about what vaccines are, how they work, how they're developed, and what they do in your body. So if you need links to any of those websites, please get in touch. Listen to this video again if you didn't catch them. And if you want to ask me something, then feel free to contact us at Rare Cancers Australia. I'll see you next time.